We have so many patients come here with vertigo or dizziness, and they just don't understand why their physicians are not able to figure out what's going on with them. And the reason is the vestibular system's very, very complicated. So there's the inner ear, which everyone's familiar with, and that senses if you're rotating in space or translating in space, and there are problems that occur in there and treatments that occur in there. And usually if you go to an ear, nose, and throat therapist, they'll give you exercises to do that would correct it. And those are peripheral vertigos. And then you have a problem with the nerve as it sends the message to the brain. And those are all called peripheral vertigo. And if that's all you have, it's not that hard to fix. But the problem is that if you get a problem with your peripheral vestibular system, then the central vestibular system changes and it adapts and it goes through what we call these neuroplastic changes. So now, if your inner ear on the left was firing too high, then your brain adapts to try to balance out the left side of the inner ear and the right side of the inner ear. And you can have that adaptation occur in different places. So one would be down low in your brain in your vestibular nuclei. And if those adaptations occur there, they oftentimes are associated with problems with digestion or bowel function or nausea. You can just imagine people get nauseous and they get dizzy. And a lot of times they're told that it doesn't make sense that they would be nauseous or have digestive problems, but it really does. It's documented in the medical literature, and neurophysiologically, the centers that control your digestive system are right there next to the vestibular nuclei. Then going a little bit higher, you can get some problems in your midbrain, which is a stress and anxiety center. And those people very frequently will become light and sound sensitive along with their vestibular disorders. Or if you get a problem much higher in your brain, in your cerebrum, and we just talk about this one area that's back in here called your parietal insular vestibular cortex. It's an association area, and there's many of these in the brain, but that is a popular one, where strange things can happen, where you might feel like one of your hands is bigger than the other, or one of your legs is heavier, or one of your legs is lighter, or there's things tingling in your body, and it's these sensations that you just don't feel right in some way, or your world is out of balance. And unfortunately, people are very frequently told that they have anxiety and given anxiety medications, but in reality, they're having a problem with their vestibular system. It's just in higher integrative centers. And we're able to examine you, we're able to triangulate where those problems are, and then develop treatment plans specific to you that help you to regain and restore function. But this is why it's so confusing for people, because they have to be able to evaluate all the different areas of the brain, not just one area of their specialty.